Probably a question for all the vaccines. So unfortunately, some misconceptions. That's probably the most in South Africa, the biggest reason why people don't go for the vaccine or don't get the vaccine, any vaccine, not just measles. And then factors like far off rural areas, that can be a factor. But in terms of measles, the vaccine it's available. It's not out of stock. Most of the clinics got it. In the private sector, all the retail pharmacy clinics got it. So it's available. You can definitely make a plan to get a measles vaccine. Absolutely. Unfortunately, with COVID, and I must unfortunately say this, with COVID, there was a decrease in immunization. Obviously, we know why, because of the lockdown. So that was definitely, and we see it now with the outbreaks. So our health system is a bit complex. So luckily, from August last year up till now, we have 100 more stores that provide the vaccines from the state, and that will be the measles vaccine included. It's mostly in Gauteng and the Western Cape, and we're starting now with Free State. The best way to know where you can find state stock in a Dis-Chem environment is to go onto our website and phone the call center helpline to find out. Any state vaccine, any state clinics got the measles vaccine, definitely. In Dis-Chem, if they don't have state vaccines, then they do have the private measles vaccine as well, which is very cost effective as well. If you look at the disease and what it covers for, it's really cost effective. So let's start in South Africa, and I must just mention last year the laboratory confirmed cases for measles was 1,338. That's the one thing. Secondly, we've got a surveillance check, and we've got a notifiable medical condition process. So whenever a baby or child or anybody gets to a clinic in South Africa and they've got a rash with fever, then we do have a notifiable documentation that you have to complete, and you send it to to our NICD, the notifiable for communicable diseases, that you send it to them, and it will always advise you to take a blood sample and or a throat sample and send it off to laboratory and notify the laboratory that it's for measles or rubella, but we're talking about measles now, so it's for measles. The moment when it's positive, the laboratory will notify the NICD, and the NICD have to obviously notify the WHO. So that's part of the surveillance. In worldwide, it's basically the same. They really try to make it the process the same in terms of what you have to report on, what you have to send in to be confirmed case. Unfortunately, yes, in our rural areas, far rural off areas, to send a blood sample to a lab, sometimes it's a bit difficult. So we do predict that there's some cases that's lost in South Africa, and I don't think just in South Africa, but in the world. But I do think that our stats is, what we see in terms of our stats and the report that we're getting is quite good. I might just mention to you, and worldwide, in 2021, there was 128,000 deaths due to measles in the world, which is actually, it's not right, because we have a vaccine from 1963 that really works well. So the overall policy in Dis-Chem is, if somebody comes into our Dis-Chem store, private or state stock, doesn't matter, you open a measles vaccine. Although it's a multi-dose, there's 10 dosages in one vial, we really try to assist whoever comes in to give them the measles vaccine. We will then try to get 9 people to get the vaccine within 6 hours, otherwise it's expired. So, and again, I urge everybody, It's so easy. Call the call center line, get a booking, and then we know that you are going to get the measles vaccine. Like I said, we do have stock, but sometimes there's so much that we get that we just run out of stock before the next order. In terms of how we get active in the community, we were part of the measles campaign last year with the DOH. So anybody came in and we gave them a measles vaccine, even older people, because they don't know if they had the measles vaccine. And I always say, if you don't know, vaccinate. Yeah, I wanna add to that. And it's, I understand people can be wary because they don't have enough information. The one thing that I urge all the parents always to do is to, if they search online on Google, go to reputable, websites. That's the WHO is reputable. Our government website is reputable, Department of Health. You can get very good information. And if you're still not sure, go to a clinic and ask the question. Specifically to measles. I mean, the measles vaccine has been with us, like I said, from 1963. It's been a very good vaccine, covered everything. And if you look at measles, measles is highly contagious. They say if one baby or infant or toddler get exposed to 10 unvaccinated children, 9 out of the 10 will get the measles. That's it. They will get it. So it's highly contagious. And if you really see how a sick child looks like, or sick toddler or sick baby looks like when they've got measles, I do think that they will go and definitely get the vaccine. And there's side effects and secondary conditions that can also after the measles, definitely their symptoms can be, and complications are like blindness and encephalitis. That's when your brain swells, severe diarrhea and dehydration, ear infection, and pneumonia. So in pneumonia, we know that if a baby under 5 years gets pneumonia, it's most of the time fatal if you don't get help and assistance and medical treatment immediately. So yes, urge people to please talk to a health practitioner that understands immunization, and do not just Google, because if you can Google, will Google that the earth is flat as well.